Dr. Cavanaugh, can you explain to us some of the COVID-19 effects on the heart?
Sure. One of the things that we're seeing more of right now is something called myocarditis, which is actually a viral infection of the heart muscle as a result of the COVID-19. And what happens as a result of that virus getting into the heart muscle is it can transiently make the heart muscle weak. And as a result, people are showing up with heart failure symptoms, shortness of breath, swelling, and some people are even sicker than that and can present with something called a cardiogenic shock, which means that the blood pressure is getting low as a result of the heart not being able to pump enough blood to the body.
Can you tell us some of the things that you at the Heart Hospital would do to take care of these patients?
It's something we're trained to recognize and care for quickly. And this is something that if we see a patient in our emergency room, we're able to get an emergent echocardiogram, which is an ultrasound of the heart muscle, to see the condition of that muscle. And if it is sick and weak, there are medications we can give in an emergency and medicines that we can give by vein to get fluid out of the lungs in a hurry.
And what would you say to people who are sitting at home as far as trying to make certain that they're still receiving their physician's advice online and in coming to the hospital?
So one of the things we're stressing is to not be scared to get medical attention if you need it. It's clear right now in the cardiology community that more people are dying at home of heart disease because they're scared to go to the emergency room. One of the things I don't want any of our patients to think is that it is an unsafe place to receive care in the emergency room. We have separate units for our COVID patients, so if you come in, you are isolated from other patients. All the healthcare workers are wearing masks. We do our best and are incredibly diligent about keeping you safe and the staff safe in the hospital. So the key is, if you have symptoms and you're scared, get to the emergency room. If you're critically ill, don't be afraid to call 911. But if there's just symptoms going on and you want to get attention, we're happy to see it by video visit so that we can keep that distance and give you advice, whether it's something you need to get medical attention for urgently, or if it's something we can just adjust medicines on the phone and then follow up with you a couple days later.
And if you need to see a cardiologist through the Heart Institute, how do we make contact with you? How do we get a hold of you to get an appointment for a video visit?
So the easiest way to do it is to call our main number, which is 841-1000. We can get you an appointment same day with one of our physicians. One of the things that's happened in this crisis is that our schedules have opened up because people are scared to come and see us. So the one good thing is that we have availability to see patients within minutes to hours. And we can also follow up with you in a serial way every couple of days to assess your progress. But more than anything, we have that ability then to tell you if it's something you need to get to the emergency room for or be hospitalized for.
And what kind of symptoms would patients be looking for that would trigger them at this point to call 911?
So if you're getting heart attack symptoms, which classically are substernal chest pressure or pain that's radiating to the arm, up to your jaw, sweatiness, nausea, those are all things that you need to seek emergent medical attention for. Listen to your body. If something scary is going on and you're having pain in your chest and you don't know what's going on, call 911. EMS is trained to come out to your house. They're in full protective gear with masks. They're going to assess you and decide if you need to come to the emergency room. But don't get in a car with a relative if you're having chest pain. You need to have EMS transport you, because if something bad happens in the car, you leave your relative with a serious problem.
Any other advice that you'd like to give the outlying facilities who are facing this situation and still trying to care for cardiac patients?
Yeah, we're available to you. As a patient, don't be afraid to come and see us. The emergency department in the hospital is an incredibly safe place to receive urgent medical attention. We're doing everything we can to protect you, your family, and the healthcare workers.
Thank you, Dr. Cavanaugh.
You're welcome.